All right, so are you ready to dive into some seriously cool AI research?
Always.
Okay, good, because today we're looking at this paper about a system called ELIXR, and it's really making some noise in the world of radiology.
Yeah, it's pretty exciting stuff.
So ELIXR, how about you give us like a quick overview?
Sure, so ELIXR, it stands for Embeddings for Language Image Aligned X-rays. And basically what it's doing is it's combining a powerful vision encoder with a large language model. You can think of the vision encoder as the eyes of the system and the large language model as like the brain.
Okay, so it's like it can see and think at the same time.
Yeah, exactly. And this allows ELIXR to understand not just the X-ray image itself, but also the accompanying radiology report.
So it's reading the reports too.
It's learning to connect those visual features in the X-ray with the radiologist's interpretation in the report.
Hmm, that's fascinating. So it's almost like ELIXR is learning to speak the language of radiology.
That's a great way to put it.
So how does it actually learn this language?
Well, it's trained on a massive data set over 1 million chest X-rays and their corresponding reports.
Wow, 1 million, that's huge.
It is. And here's the really cool part. No manual labeling is required.
Oh, so they don't have to go through and like tag each image with what it shows.
Exactly. That's
Yeah.
right. Traditional AI models require a ton of labeled data, which is expensive and time-consuming to create. But ELIXR bypasses that by learning directly from the reports.
That's a total game changer.
It is. It really opens up the possibilities for AI in healthcare.
Okay, so we've talked about what it is and how it learns, but what can ELIXR actually do?
Well, one of the most impressive things is its ability to do what we call zero-shot classification.
Zero-shot classification, what does that even mean?
It means that ELIXR can accurately identify conditions on a chest X-ray, even if it's never been specifically trained on those conditions.
Wait, really? So you're telling me it can diagnose something it's never seen before?
Yeah, it can, and it does it with a really high degree of accuracy.
That is wild. How is
Yeah.
that even possible?
It's because of ELIXR's sophisticated understanding of both images and medical language. It can draw connections between what it sees in the X-ray and the descriptions in the reports, even if the language is slightly different from what it was trained on.
It's like teaching someone the basics of a language, and then they can suddenly understand complex literature.
Precisely. That's a great analogy. And that's just one of its capabilities.
Okay, so what else can it do?
Well, another really useful feature is semantic search.
Semantic search.
Yeah, imagine you're a radiologist and
Yeah.
you're trying to find specific cases in a huge database of X-rays.
Yeah, that sounds like it could take forever.
It could. But with ELIXR, you can just type in a plain language query, like pleural effusion or moderate cardiomegaly, and it will pull up all the relevant images.
So it's like a super-powered search engine for X-rays.
Exactly. And this has huge implications for research education and clinical practice.
I can see that being so helpful for radiologists.
Absolutely.
And there's even more.
There's more. What else can this thing do? Well, remember those large language models we talked about?
Yeah.
They give ELIXR some very unique capabilities like visual question answering.
Visual question answering. Like I can ask it questions about an X-ray.
Exactly. You can ask things like, is there evidence of a pneumothorax? Or where is the lung lesion located? And ELIXR will actually try to give you accurate answers based on its analysis of the image.
It's like having an AI radiology resident at your disposal.
That's a great way to think about it.
Yeah.
And this has huge potential for medical education.
Wow. I bet students would love to have something like that to practice with.
And there's one more feature I want to highlight.
Okay, hit me with it.
Report quality assurance.
That sounds intriguing. Tell me more.
So ELIXR can analyze radiology reports for potential errors or inconsistencies.
So it's like a second set of eyes checking the radiologist's work.
Exactly. It's like having another highly trained expert reviewing the report to make sure everything makes sense and nothing important was missed.
Wow, so ELIXR is like a safety net for radiologists.
That's a good way to put it. And it could have a huge impact on patient care.
Yeah, catching those little errors that can sometimes slip through the cracks could be a real game changer.
Absolutely. Even the most experienced radiologists can make mistakes, especially when they're tired or dealing with a heavy workload. ELIXR can help reduce those errors and ensure that patients are getting the most accurate diagnoses possible.
That's incredibly powerful. So we've got an AI that can diagnose conditions it's never seen before, search through massive databases of images, answer questions about X-rays, and even double-check a radiologist's work. I mean, what can't this thing do?
Well, it's still under development, and there are some limitations we need to be aware of.
Okay, let's talk about that because it all sounds a little too good to be true.
Right. Well, one thing is that right now, ELIXR is really focused on chest X-rays. Expanding its capabilities to other imaging modalities like CT scans or MRIs is going to take some time and effort.
Yeah, I imagine each type of imaging has its own unique challenges.
Definitely. And there's also the issue of generalizability.
Generalizability.
Yeah, making sure that ELIXR works reliably across different data sets and real-world scenarios. Because even within chest x-rays, there can be variations in image quality, patient positioning, and how diseases present themselves.
So it's not just a matter of feeding it any old X-ray and expecting perfect results.
Exactly. Rigorous testing and validation are going to be crucial before we see widespread adoption of ELIXR in clinical settings.
That makes sense. And even then, I imagine human oversight is still going to be really important.
Absolutely. AI can be a powerful tool, but it's not a replacement for the expertise and judgment of trained medical professionals.
It's about finding that right balance between leveraging AI's strengths and maintaining the crucial role of doctors.
I completely agree. The goal isn't to replace doctors, but to give them better tools and information so they can focus on what truly matters to their patients.
Well said. So it sounds like ELIXR has the potential to revolutionize radiology, but it also raises a lot of questions about the future of healthcare and the role of doctors in an AI-driven world.
Absolutely, and that's something we need to carefully consider as we move forward with this technology.
Okay, so let's shift gears now and delve into some of those broader implications. How might ELIXR and similar AI technologies reshape the healthcare landscape in the years to come?
Well, that's a big question, and I think there are a lot of different perspectives on that.
Okay, well, let's hear them.
One thing that people often worry about is whether AI will eventually replace doctors.
Yeah, that's a valid concern, especially in a field like radiology where AI seems to be making such rapid progress.
Right, but I tend to have a more optimistic view.
Oh, okay. I'm curious to hear your take on this.
Well, I think as AI starts to handle more of those routine tasks, it actually frees up radiologists to focus on the more complex and nuanced aspects of their work.
So instead of spending hours looking at images, they can spend more time with their patients.
Exactly. And they can also collaborate more with other specialists and really dig into those challenging cases that require human expertise and intuition.
So AI could actually lead to more personalized and compassionate care.
That's my hope. It's not about man versus machine. It's about using AI to create a more human-centered healthcare system.
I like that a lot. It's about augmenting human capabilities, not replacing them.
Precisely. And let's not forget about the potential impact on the global shortage of radiologists.
Oh, yeah, that's a huge issue. In many parts of the world, people just don't have access to qualified radiologists.
Right, and that can lead to significant delays in diagnosis and treatment.
Which can obviously have devastating consequences.
Exactly. But AI could help to bridge that gap by providing diagnostic support in underserved areas.
It's like democratizing access to expert medical knowledge.
That's a great way to put it. Imagine a rural clinic in a developing country being able to use ELIXR to provide the same level of care as a major metropolitan hospital.
That's a powerful vision. It's about ensuring that everyone, regardless of where they live or their socioeconomic status, has access to quality healthcare.
Exactly. And that's the kind of future I'm excited to work towards.
Me too. It's inspiring to think about how technology can empower us to care for each other more effectively and compassionately.
Absolutely. But we also need to be mindful of the potential risks and challenges as we move forward.
Right. AI is a powerful tool, and we need to make sure we're using it responsibly and ethically.
Exactly.
Hmm.
We need to have open and honest conversations about things like bias in algorithms, transparency in decision-making, and patient privacy.
Those are all critical considerations, and we need to make sure we're involving experts from different fields, not just computer science, but also medicine, ethics, law, and social sciences.
I couldn't agree more. It's going to take a collaborative effort to ensure that AI benefits all of humanity.
Well said. So we've covered a lot of ground today. We've explored the potential of ELIXR to revolutionize radiology, improve healthcare access, transform medical education, and even impact healthcare costs. But as we've discussed, there are also some important challenges and ethical considerations that we need to address as we move forward.
Definitely. But I'm optimistic that we can rise to the occasion.
Me too. If we approach this technological revolution with wisdom, compassion, and a commitment to ethical principles, I believe that AI can help us create a healthier, more equitable, and more human-centered future for all.
I completely agree.
Yeah,
And that's a future worth striving for.
absolutely. So on that note, we'll wrap up this episode of The Deep Dive. Thanks for joining us on this exploration into the cutting edge of AI in healthcare.
It's been a pleasure.
Until next time, stay curious and keep exploring.
Yeah. And it's not just about access for patients either. Think about medical education students could learn alongside ELIXR, getting instant feedback and personalized explanations on like the most complex cases.
Oh, yeah, definitely. I mean, it'd be like having a world-class radiologist available 24/7 to guide your learning. ELIXR could like totally revolutionize how we train new doctors.
Right, making med school more interactive, more engaging, and way more accessible.
Exactly.
So it seems like ELIXR is not just about making radiology more efficient. It's about like transforming healthcare as a whole, empowering doctors, improving access, and ultimately leading to better outcomes for patients.
Huh.
I think that's a really great way to sum it up.
Okay, but speaking of patient care, I think it's important to acknowledge that any new tech, especially in healthcare, comes with challenges and limitations.
Oh, for sure. You're absolutely right. ELIXR is super promising, but it's still being developed. And there are definitely some important things to like address as we move forward.
So what are some of those areas where we need to be careful?
Well, one limitation the researchers mentioned is that ELIXR right now is mostly focused on chest x-rays. Expanding it to other types of imaging like CT scans or MRIs, that'll take a lot more work.
Yeah, that makes sense. Each type of imaging has its own like quirks and complexities.
For sure. It's not as simple as just showing the AI different pictures. You have to train it to understand the specific features and the language of each modality.
So lots of testing and validation are going to be needed before ELIXR is used in hospitals.
Oh, absolutely. And even then, human oversight is still going to be super important.
Right? AI can be a powerful tool, but it shouldn't replace the expertise and judgment of doctors.
Exactly. It's about finding the right balance. Using AI to enhance our abilities while still keeping humans at the center of patient care.
Now, I'm curious about the financial side of things. We've talked about how ELIXR could save time and training, but could it also affect healthcare costs in other ways?
That's a really good question. I mean, think
Yeah.
about how ELIXR could streamline those radiology workflows.
Okay. Yeah.
If radiologists can work more efficiently, that could lead to faster turnaround times, for reports less waiting for patients.
Potentially even lower healthcare costs overall.
Exactly.
It's really interesting to consider all the ways this technology could change things. But before we get too carried away with all the future possibilities, let's get back to the research itself. What were some of the things that really stood out to you?
Well, one of the most impressive findings was how well ELIXR performed on those zero-shot classification tasks. It actually did better than other leading AI models, even the ones specifically designed for zero-shot learning.
Wow. So it's not just a good idea in theory, it actually
Mm-mm.
works incredibly well.
It does. And what about those more complex language-based tasks, like the semantic search? How did ELIXR do there?
Yeah.
It was great there too. ELIXR was consistently able to find the right images based on text descriptions.
So it really shows how ELIXR can bridge that gap between images and text, which has been a major obstacle for AI in healthcare.
Exactly. And it's not just about finding the images. ELIXR can also analyze the reports themselves.
Right, which brings us back to that report quality assurance feature,
Exactly. It's like having an AI double-checking those reports for accuracy.
making sure everything is consistent and nothing is missing.
Exactly. And that could be so valuable in preventing errors and keeping patients safe.
Definitely. Okay, so we've talked about how ELIXR could revolutionize radiology, improve healthcare access, transform medical education, and maybe even lower healthcare costs. But I feel like there's still so much more to explore.
Yeah, ELIXR is a big step forward in medical AI,
Yeah.
but it also raises a lot of questions about the future of healthcare and what the role of doctors will be in a world with AI.
Exactly. So let's shift gears again and really dig into some of those broader implications. How might ELIXR and similar AI technologies change the healthcare landscape in the years to come? It's kind of mind-blowing to think how fast AI is changing things, especially in healthcare. We've talked about ELIXR streamlining workflows, but what about its effect on the actual role of the radiologist?
Yeah, that's a big question, isn't it? Some people worry that AI will end up replacing doctors, but I don't really see it that way.
Oh, okay. How so?
Well, as AI starts taking on more of the routine stuff, it actually frees up radiologists to focus on the more complex parts of their job.
So less time staring at images, more time actually talking with patients.
Yeah, exactly. And more time to collaborate with other specialists, to really dig into those tough cases that need human expertise.
So AI could actually lead to more personalized care.
That's what I'm hoping for. It's not about humans versus machines. It's about using AI to make healthcare more human-centered.
I like that a lot.
And there's also the impact on the global shortage of radiologists to think about.
Right. In many places, people just don't have access to qualified radiologists,
Exactly. And that can mean big delays in getting diagnosed and treated.
which can have really serious consequences.
Yeah. but AI could help close that gap by providing support in underserved areas.
It's almost like making expert knowledge available to everyone.
It is. Imagine a small clinic in a remote area being able to use ELXR. They could provide the same level of care as a big city hospital.
That's a powerful thought, that everyone could have access to quality healthcare no matter where they live.
Exactly. That's the future I'm working towards.
It's inspiring to think technology can help us care for each other better.
It really is. But we also need to remember the potential risks and challenges.
Right, AI is powerful, and we have to use it responsibly and ethically.
We need to talk about things like bias in algorithms and making sure decisions are transparent, and of course, protecting patient privacy.
Those are all really important, and we need to bring in experts from different fields.
Definitely not just computer scientists, but also doctors, ethicists, lawyers, social scientists.
It's going to take all of us working together to make sure AI benefits everyone.
Absolutely.
Well, we've covered a lot today. We've explored how ELIXR could revolutionize radiology, improve healthcare access, change how doctors are trained, and even impact healthcare costs. But we also need to think about those challenges and ethical questions as we move forward.
Definitely.
I'm optimistic, though. I think we can do this. If we approach this new technology with care and a focus on doing the right thing, I think AI can help us create a healthier and more equitable future for everyone.
I agree. That's a future worth fighting for.
And on that note, we'll wrap up this episode of The Deep Dive. Thanks for joining us as we explored the world of AI and healthcare.
It's been great talking with you.
Until next time, stay curious and keep exploring.